All right, welcome everyone to today's Foundations of Global Health. We're excited that you are able to join us. We also have a sign language interpreter with us today. Carrie is with us. Thank you, Carrie, for being here. If you please look in the chat as to how you can pin the video if you wouldn't want to make use of the sign language interpreter. So global health is a varied and exciting field to which many healthcare providers, researchers, and faculty aspire to being professionally engaged. With our being globally connected world and with COVID-19 uniting the world to solve an issue, global health has never been more relevant. This year-long programming is designed to feature our experts in the field of global health, KUMC's faculty, researchers, and clinicians, our international partners, and our community partners. Each presenter will share his or her personal story, educational background, mentors, books, and articles that gave inspiration, challenges, lessons learned, successes, epiphanies, thank you, epiphanies, life-changing moments, and heartbreaks. Thank you, Alexa. No, you're fine. No worries at all. No worries. We have several learning objectives with our Foundations of Global Health.
May need to supply the code for us to view.
Okay, there we go. We hope that the learner will gain foundational information on pathways into global health and will be challenged to deepen knowledge on equality and mutualism, which garners true collaboration and global health exchange for everyone's equal benefit. The learner will examine existing attitudes around global health so that we at the University of Kansas Medical Center are trendsetters who move beyond the us versus them and have versus have not mentality. And we also hope that the learner will be able to appraise global health, including global health research, philosophy, approaches, attitudes, and the varied efforts in the areas of health disparities, health inequalities, and community health. We have several upcoming events in this series. Today, we're very excited to have Dr. Anthony Kovac present to us. On April 22nd, we will have a student panel that will speak on international educational global health experiences. Additionally, on Tuesday, May 4th, we will have Dr. Julian Franco, who will be giving a presentation on introduction to the School of Medicine at, and I'm sorry, I'm going to butcher this, Universidad de Antioquia. Dr. Kovac, you probably be able to pronounce this better than me, or healthy public policies and the use of framework to help the decision makers. And we are also excited to welcome Dr. Komninelis on Wednesday, May 12th, and he will give a presentation on post-COVID global health. All right, it is my honor to present Dr. Anthony Kovac. Dr. Kovac is a professor at the University of Kansas Medical Center, Department of Anesthesiology, with joint deployment as affiliate professor in the Department of History and Philosophy of Medicine, and graduate appointment in the Department of Nurse Anesthesia Education at the KU Medical Center. He earned his MD degree from the KU Medical Center. He did an internship at Mercy Medical Center in Denver, Colorado, and his residency in anesthesiology, again, at the KU Medical Center. He has been on staff at KUMC since 1981. Dr. Kovac received the Kasumi Arakwa Professorship Award in Anesthesiology in 2013. Did I mispronounce that one? There we go. Perfect. Thank you. In 2003, the Wood Library and Museum Rod Calverley Fellowship in History of Anesthesiology in 2008, and the Eugene Pierce Fellowship in History of Medicine, Clendenning Library and Museum in 2010 at the KU Medical Center. In 2016, Dr. Kovac initiated the Kovac International Observership Award to sponsor international bidirectional exchange of education, research, and culture by residents and students observing medical systems and practices in Peru and Ghana. In February 2020, for a 3-year term, Dr. Kovac was chosen to be a member of the Fulbright Specialist Roster Program established in 2001 by the U.S. Department of State, Bureau of Educational and Cultural Affairs. Without further ado, I would like to virtually hand the microphone over to Dr. Kovac. Thank you for being with us today.
Thank you very much. It's an honor and pleasure to be here today as part of the Office of International Programs series. They're definitely a division of the university I firmly believe in, and you know, I hope for many years to have a great relationship. Today, going to talk about international exchange between Peru, Ghana, and the USA. And initially, I thought I would be talking about a study I conducted about the development of bidirectional exchange. And then, but actually, you know, after hearing Dr. Mani's presentation and and seeing what the true spirit of this is, really to talk about our life experiences and how we got into global health. I'm more or less emphasizing that. Maybe at a future time I can talk about that particular study. At the KU Medical Center, Dr. Mani is a mentor, friend, colleague, and I want to read a quote from him he sent to me after his presentation. When you challenge your students, residents, and colleagues, take them away out of their comfort zones, make them feel utterly uncomfortable and out of their depth. So I'm learning how to do that. I'll say that quote at the end. I want to allow time for discussion too, of the members that are here that are from Peru and Ghana. But you know, I was going to say, well, can you go to the next slide? So first, what is the story of my start into global health? Which is really, you know, when compared to Dr. Mani and Dr. Kamenelis, it's short. Really going on now perhaps 6-7 years. What challenges, mistakes, and lessons have I learned? Next slide. First, the Peru experience. You know, Peru, a wonderful country, about 32 million people. In Lima, there's about 10.7 million people. It's one in which there are the oceans, the plains, the mountains, and probably the one thing that we always mention about is the iconic and historic and famous Machu Picchu. Next slide. In talking about and thinking about this presentation, it really gave me time to think and reflect. So if I was to put a date in which I really started on this global journey, it's July 3rd, 2014. Because when you look back on my academic career, I you know, have done stuff in history, and I've done, and clinically, I've been involved with numerous multi-center studies with the development of antiemetics for postoperative nausea and vomiting. So it was in July, a drug company, they invited me to come to Lima, Peru, and give a talk on second generation anti-medical palonositron. So this is a picture of in front of the poster and the 3 representatives. And I was there going to be there for 3 days and 3 nights. And so I said, well, I want to see more than just the hotel and the airport. And I says, I would like to not only see the city, but visit some hospitals and clinics. So one of the clinics they took me to was the Clinica Anglo-Americano, one in San Ysidro, a private clinic, very nice for operating rooms, very well equipped. And then they also said, well, the other day they said, well, they're going to take me to a hospital called Enon, the cancer hospital. Next slide. And so it's the Instituto Nacional de Enfermedades Neoplásicas, a wonderful hospital. And I had the opportunity to tour, and next slide, and meet this individual who is not, I consider a friend, a colleague, Dr. Juan Urquizo. So at that time, Dr. Urquizo was chairman of the Department of Anesthesiology at Enon. And we went around and he gave me a tour, and they were renovating the operating rooms. And he's one of those individuals, you know, that within 5 or 10 minutes, something clicks. And the interesting thing, he could not be at my presentation, but he said, he says, I do not, let me step back. A couple of things he said that really stuck with me was, one, I love my hospital. He had trained there and he had been working there. The second thing he said, and he is involved with the Peru Society of Anesthesiology. He's been the liaison. He knows all the politics, the science of anesthesiology in Peru and his hospital. And he said, anesthesia in my hospital can be improved. Anesthesia in Peru can be improved. And, you know, that humble statement, I thought I had never, you know, I guess I'm saying, I was so impressed and taken by that. And he told me, he said, I don't know about your drug, but come back a day, a week, a month, and teach us. And so, you know, I thought about that going home. And if you, next slide. And it's sort of basically a time in my life when, in that particular year, my son had passed away. And one thing is, I think, is when cuando una puerta se cierra, otra puerta se abre. When one door closes, another door opens. Next slide. And it was kind of a thing of an invitation to teach at Enon. At that time, at that day, if you would think that, oh, I'd be going back and spending a month in Lima, Peru, I wouldn't have known that. But the opportunity with the idea and a different philosophy than, let's say, a medical mission. I more or less think I go to a medical education mission, but the fact that if you teach them how to fish, you teach a person for a lifetime. Next slide. Okay, I wanted to learn Spanish. So one of the things, and we talked about that, and Dr. Urquizo mentioned, it's a lifelong process, just like learning English. So on the internet, I learned about a school, Escuela Peruana, and it's a Spanish immersion school for foreigners, extranjeros in Lima. And on the upper slide, you can see my teachers. And it's basically, a lot of times, there's young people, old people, retirees of all sorts, a very nice school. In my journey, which I'm still trying to learn Spanish. Next slide. A part of the experience and this immersion experience is that you go to classes in the morning. The idea, you would go around the city and practice, and in the evening, spend time with the host family to practice Spanish. And there I met this family. It's Jeremy and Yasmin, where they would take in the students, and I met them. In the back is their nieces. To the right or left are 2 of their friends. But a unique experience to not only practice Spanish, live with the family, and learn the culture. Next slide. Well, in September 2015, I went back. I went to the challenge and the opportunity that Dr. Kizo had mentioned, and met, and this was a particular day. It's one of my favorite photos in which they're all the residents. These are the residents at Enan, the anesthesiology residents. And a particular note is that on the, I guess the far right is Delia Cantinares, who I'll talk about too later. I believe that her name is kneeling is, or is squatting is Maria, and then other there's Marjorie, Dahlia. A lot of the other residents, they did speak English. So even though I didn't know Spanish, I gave my presentations teaching in English, and they translated into Spanish. Next slide. One of the things they wanted to learn was fiber optic intubation. And so I asked Dr. Keys, okay, you have a mannequin? And he said, oh, we have a mannequin. And so I came, and they had a fiber optic scope. However, when I got there, the trachea portion of the mannequin wasn't working. And so I thought, oh, and this is more or less the things, even like Dr. Mani will say, you know, the unexpected will come and things will not be available, so you have to adapt. So I thought, oh gosh, what am I going to do? But I knew that but the principles that I wanted to teach were the hand-eye coordination. So I said, piece of cardboard, I put a hole in the cardboard with a triangle, and more or less we learned over a 3-day period. The first was didactic, the second day was practice, and the third day was to go into the operating room, learning the principles of rotating the scope, left, right, up, down, and so on. Next slide. Well, one of the days in the middle of the week, one of the anesthesiologists said, well, at the children's hospital and in the burn unit, which has they have a burn unit, that they were doing some burn reconstruction, and that on a patient with a very difficult airway that they could not secure, and that they had the difficultest time in trying, which they gave up to come in there. They said, well, would I come over and help them use a fiber optic bronchoscope? And so I said, well, okay. I checked with Dr. Kizo, is that okay? It was one in which I was not going to do it myself, but I said, I will do that. I help the anesthesiologist. And this is one thing I kind of leave it to Dr. Mani, where they say, well, on that particular graft, but a particular thing I'd like you to notice is that as it had healed, it was really hard. The patient had difficulty extending the neck, and there was not an opening the mouth. You can see where their tongue is at. You can see that this would be difficult to place the breathing tube, the endotracheal tube, essentially normally. I'd just like to notice this is the post-op picture that after the plastic surgeons, the burn surgeons had released this area, it was more pliable. One thing I learned from Dr. Urquizo, Dr. Chavez, a lot of the other anesthesiologists in Enan, as well as this anesthesiologist. I'm sorry I've forgotten her name, but they are so skilled in the basics of anesthesia, the airway, at a time in which it was, I was really thinking we were going to have trouble. And which is, I always tell her she has great hands, because she essentially saved the situation and made it so we could intubate the patient. Next slide. The outcome was good, and so afterwards, I asked the recovery room nurses, the 5 ladies on the right are recovery room nurses, the 2 ladies on the left are anesthesiologists. I said, can I take my picture with you? And so they obliged, and I thought, oh, that's great. It's one of my favorite pictures because I guess you'd say maybe the average size of ladies in Peru, and then there am I. I guess it's a thing too that I noticed that the people in Peru and Ghana, they like to take pictures, and I like to take pictures with them. Next slide. So one of the things too I learned, and I put this in just an example of a poster. One of the things I believe to do is with education research is to go to meetings, to report. And in this particular thing of what I've learned is, okay, low cost, low resource materials to teach fiber optics. It's one thing when I go, I want to do cooperative projects with Peru and Ghana. And here you can see that at KU Med Center, Enan, and in addition to my name, I put, Delia Cantinares and Dr. Kizo's name. So I see these opportunities for scholarship that we can do together. Next slide. One of the nice things that I see a thirst for knowledge that they have in Peru and Ghana. Even after working long days, they will still wait and listen to a lecture. Next slide. I think it's amazing. Here we are in 2001, and we have the technology of Zoom. Well, one of the things that we did more or less like in 2015, 2016, is a project I worked with one of our nurse anesthesia students. And this is Sam Martinez. Sam Martinez is in Kansas City giving a lecture in Spanish to the Enan audience. So, things that we did now and that were essentially you had to have a camera in an auditorium, now we can do in our offices. And I think this is a good opportunity for us to share bidirectionally and to learn together. Next slide. A particular, this was just his master's thesis, was the development and assessment of learning non-native language anesthesia concepts using native language subtitles. One of the things is that to the Peru group, the lecture was in English with Spanish subtitles, and then there was a Kansas group that it was in Spanish with English subtitles. Next slide. I think one of the interesting things was, especially with the residents in Peru, this was really no big deal, because one thing they confirmed that observation, watching movies and videos with subtitles in their native language was common and successful for non-English speakers. And they readily said that they watch a lot of American movies. It's in English, but they have Spanish subtitles. So I think this was another thing of how to bridge gaps and do global health education. Next slide. I bring this in is one of the things that we've done in our department was have rotations, international rotations for our residents. And these are international rotations in which they're approved by the American Board of Anesthesiology. So the resident will get credit for their international experience. This shows anesthesiology residents, Hans Tregler, who just this last February 2020, we were at the Hospital Loaiza, and he's demonstrating the use of ultrasound. I know Karina's on the line. I believe this is her watching the demonstration, and one of our other international visitors, Jonathan, served as a model. Next slide. One of the other things, another wonderful place that we've developed our relationship as well is with the Instituto Materno Perinatal, basically the mother's hospital. And I see wonderful opportunities for not only anesthesiology and all these hospitals, not only anesthesiology, but medicine, surgery, family practice, emergency medicine, etc. Next slide. Part of the thing that, when I go, I'm a representative for KU, my department, the Office of International Programs, and I want to promote these cooperative agreements. And it takes a lot of work to do these things. And it takes key people that help me, Dr. Kizo, Delia, helped, to meet the right people, to get the approval of chairmen, and then to meet the CEOs. I mean, these are CEOs, practicing doctors that are appointed by the Ministry of Health. They are high positions, and these are two pictures with the CEO of Enan. We started the cooperative agreement, and also that of the Children's Hospital, Instituto Nacional de Salud del Niños. We also have one with the Instituto Nacional Materno Perinatal, and perhaps we'll work on getting one with Hospital Loesa. I would also have to mention that we also have cooperative agreements with universities, the Cayetano University in Lima, and these give us, I think, opportunities not only for students, faculty in the schools of medicine, nursing, and health professions, but also graduate studies and our basic scientists. Next. Next, I'd like to talk about the Ghana experience. So how in the world do we go from Peru to Ghana? Well, Ghana has a population of 31 million people. The capital is Accra, and the city that we visit is Kumasi. Next slide. The hospital we go is the Kamfo Anochi Teaching Hospital, a large teaching hospital. I believe Fred has told me it's maybe 1,100, 1,200 beds, general hospital, all types of specialties. Next. So where did this all start? Look at on the graph, you'll see a gentleman in a blue shirt, Dr. Mark Brulette. He's basically, we consider him the pioneer of global health in our department, because I believe he went to, I don't know if the University of Utah or California, but as a medical student, he started going to Ghana, and he met Dr. Alfred Adu. The tall gentleman is Dr. Alex Hermanson, who as a medical student went to KATH and stayed with Alfred. We had hoped we would go in 2019 or 2020, last year, but unfortunately with COVID, we couldn't. Alfred also had come as a regular visitor. He came in 2017 while he was appointed I think a fellow with the American Association of Respiratory Care. Next slide. So Kovac visits Kumasi. Okay, so here I think, as I remember the day, met with Kimberly. We went with Dean Akinwuntan's office and also Karen Schnell and talked with her going to Ghana. I'd never been to Ghana before, but one of the things I thought, well, maybe I would. I still remember the day in which I'm sitting with Mark in the preoperative area, and I said, Mark, I'm thinking of going to Ghana. And Mark said, well, they're waiting for you. Just go. Next slide. So this is one of the wonderful things of culture. This is Alfred, and this is his wonderful family, Cara, Adele, and Carmen. I think it's one of the things that that makes it a pleasure, and it's one that I'm so happy to know them. Next slide. One can say, who is Dr. Alfred Adu? He's also a pastor, a reverend. And you can see by these slides, he has such a passion. He will bring the simplest biblical things in the Bible to simple terms and mesmerize people. They will come to see him. I think what's amazing, and this was a recent picture he sent me, the church is packed, and it's packed with young people. This is the type of person here. Not only a doctor, but also a pastor. He treats the body as well as the mind and the spirit. Next slide. So one of the things that I like to do, like I say, I like to stay with host families. I like to experience the people. I don't want to stay in a hotel. So one of the things that I wanted to do, as medical students and residents had stayed with Alfred and his family, I wanted to also stay with his family. And so this is the KATH residence doctor housing. And as one can see on this, on one side, it's right next to a very busy street. Next slide. Well, I want to get to this thing of the white coat story. So one of the things that I did is, and I guess things that they would ask me was, well, why would Dr. Kovac stay in Alfred's place? And I said, well, I wanted to experience him and meet his family. So I had arrived there on Accra on one night, spent the night, the next day flew to Kumasi, and then met Alfred's family. So I still remember the day and thinking, and this is one of the things I think would say is, when Kimberly and we will talk about stretching your international senses. You know, here I'm going to, at that time it's cold in Kansas, I'm going to a area of the world where it's hot. It's the one in which I had to get yellow fever, you know, of course I had hepatitis, but you know, you get all the shots, you have to take malaria pills. It's one in which I'm now in a Black society. It's one in which I think you can really stretch your sensibilities. I want to say though, I think the same thing when I went to Peru and Lima. You know, I'm now in a Latino. I was in a society in which I couldn't speak the language. You know, habla español nada. I couldn't speak anything. And those are the things I think when you stretch your sensibilities, you really get the international experience. I'm wearing, I wanted to wear a white coat and shirt today for the white coat story. So here I am, my first night in Kumasi, and Alfred in his small apartment had an area in which the residents could or medical students could stay, and no air conditioning. I have a fan blowing on me so I can get some relief. It's one in which there's no hot water, you know, and there's still a lot of noise on the outside window, which gradually dissipates. And you know, I guess in some ways I was trying to think about things. And one thing I realized is I have nothing to complain about. And there's a kind of a rule I developed. I'll show it at the end too, but it's the HALT rule. If I see anybody complaining, I like to say HALT. You know, you should be humble, appreciate, learn, and teach. That we have nothing to complain about. So I'm laying in bed, and finally I get to sleep, and then I hear this noise at about 3:30 in the morning. I look at 3:30, and I kind of push the curtain away, and I see Alfred. And I say, Alfred, what are you doing? And Alfred says, I want you to look good tomorrow. You're going to meet the residents, the staff, and the CEO. And so he was ironing my shirt and coat. And I just couldn't believe it, but I said, okay, well, thank you very much. And then went to sleep. I showed this picture because even I told him, I says, I don't think my wife would get up at 3:30 in the morning and watch and iron my coat. But this is my coat, and here I gave my presentation, and I'm in the ICU with rounds, and I think to myself, looking back on this, wow, that coat looks really, really nice, and thank you, Alfred. Next slide. And so that was one of the things too that in my meeting with the CEO, I think I also looked nice. I said it was just, I had to thank Alfred. You know, afterwards I got back and I told Dean Conjoined the story, and he said, Tony, he said, that's the African way. And Alfred wanted you to look the best that day. So, you know, one of the things too, and I try to do this similar as I did in Lima and Peru with the hospitals, is meet with the CEO, meet with the medical directors, you know, as well as the chairman. We were guests in their hospitals, and I represent KU department, like I said. And on this particular day, Kimberly had made these nice gifts to show as our appreciation and the start of a continuing friendship in which that I gave those, and this was Dr. Akpalu. And he is a practicing consultant plastic surgeon. And so I think this was the start of the thing in which we would then, we're hoping to get a cooperative agreement. Next slide. Of which then we did get a cooperative agreement, once again, for the exchange of education, research, and culture. These agreements have nothing to do financially, but it's just that, you know, in addition to the science, we want to learn the culture, we want to learn your people. And not only we learn you, but you learn us. And this was a meeting with, and I think it's Owusu Dansu, the CEO, and I believe he is also a consulting plastic surgeon. Once again, Alfred. Alfred is these are key people. We would not make the progress we have today without key people like Dr. Akizo and Delia in Peru, or Alfred in KATH. Also, Dr. Kusi. Kusi was at that time chairman, I think, that the department. And they're also key individuals that help with these, to develop these cooperative agreements. And I'm thankful to them. Next slide. I like to say, I like to take pictures. So here in 2017, I took the pictures with the Ghana residents. And the thing I like to notice thinking about these is that now there is Moses, one of the, and then Alfred, but the other are African ladies. They're higher in height than the Peruvian ladies, but similar to the Peruvian ladies, beautiful ladies with beautiful smiles. Next slide. I show this too is to show that, you know, we are developing not only with the medical students, not only with the nurse anesthesia students, but the residents to develop these international rotations. Dr. Cole Holgren, in November 2018, before our departmental international rotation, he received a health volunteer overseas grant to come over to KATH. And he's teaching at an airway station. Next slide. We're talking about different things that I learned. This was in November 2018. I gave, on 7 days, I had 7 courses. There were about 10, 12 people in each. You could say one of the things that I learned from this, and I'm going to do differently, is that I was teaching the course. The next time I come, I want to teach the teachers that will then take over and continue the course. And that's one thing that I've learned. I'm taking some online courses with a group called InMed, and talking to one of our instructors last year is a wonderful gentleman, Dr. Paul Larson at the University of Pittsburgh. We talked about, and we'll talk about later, is you want to enable them and empower them and let them be the teachers. And so the next time I will come, I want to teach the teachers. This is Dr. Nanuadu, one of the chief residents, Dr. Maxwell. I'm sorry to forget his last name, but he emergency medicine, now chair of emergency medicine at KATH. Next slide. One of the things in February of 2019, Professor Zachariah, who was the CEO of the Ghana National Ambulance Service, visited KU. And there he toured community colleges, Kansas City, Kansas, Johnson County, different fire departments to learn about EMS in Kansas, and also met Dr. Dennis Allen, who then in September 2019, in a course led by Dr. Allen and KU's emergency medicine department, and I helped facilitate it. That's the organization. We came as a team. On the far left is a paramedic who taught at the course. There's Alfred and myself, you could say, as anesthesiologists. Dr. Allen, the emergency medicine. Paul Bennett's, my friend and colleagues in nurse anesthesia. And we have 2 nurse anesthesia students and an anesthesiology resident. So I think, as one can see, the idea, it's a dream I have, is we go over as teams, we teach as teams, we learn as teams. Next slide. And these are slides just kind of show, here's Dr. Hillary Sheridan teaching at an airway station course. Next slide. And also, I like this slide because it shows that both nurse anesthesia and anesthesiology were teaching at this course. And specifically notice that when you train EMT and paramedics, you want to put the mannequins on the floor, because they won't be on a table you can raise up and down. Most time patients or victims will be on the floor, on the sofa, and other areas. So they were different practicing CPR, airway techniques. Next slide. I think an interesting thing we try to do is become involved and see the people. And this was after a church service at Alfred's church, just a simple blood pressure clinic, taking blood pressures, talking about the simple things. And one thing I myself learned taking the InMed course is how nutrition, diet, water, sanitation, vaccination, very many simple things can really help healthcare. Next slide. One of the things we try to do is give some donations, and these are some donations that Karen Schnell had brought together, and that we gave respiratory therapy equipment. These were the in ICU, the endotracheal tube holders, also and ambu bags. And one thing that I try to do and bring over is the laryngoscopes that we just use once at KU and are really then thrown away, collected, cleaned, and then we can bring them over and use. And the battery life is still used for 8 or 12 months more. Next slide. I bring this slide too is the fact that the importance of nurse anesthesia in Ghana, and as well as it is in the United States at KU, and the fact that in going over as a team, here's Paul Bennett's on the left, Philip Kaiti, who was a Ghanaian that went to bring back home, and Rebecca Wiebelhaus, things that our students at KU will go and can help do their senior project. And this was one thing too, is there ways we can help the nurse anesthesia program at KATH? Next slide. One of the things too, I think we can help, and we have helped, was that there's an update anesthesia conference for the nurse anesthetists and anesthesiologists. And both Paul and I have been part of this. The first year we were just Paul and I, and then the second year we also had the resident and nurse anesthesia students. But one thing I've learned in talking to Paul Larson on my InMed course was that the next time I go, I want the doctors, the students, the nurse anesthetists at KATH also to be involved. That we will give lectures together. That we have perhaps roundtables together, discussions together. That it's not only just us coming over there, but that we want them to be involved, and that we're part of their conference. Next slide. I just show this this is where I've stayed and also with Paul and the nurse anesthesia students at the Ghana Revenue Guest House, a bed and breakfast, I think about 12, 13 rooms. The nice thing, it does have air conditioning, and I've gotten to know like the front desk clerk named Seth, Solomon, the manager, Florence, the maid, and I think I added up perhaps 80, maybe I've stayed 80 nights at the guest house in 3 years. Next slide. Clinical challenges. And I just want to just mention a few of these things, just kind of looking at the time, but next slide. Dr. Mani showed an example of a patient that he had. So I want to show this as just to show the depth and the type of patient's pathology that you can see and learn. Just think that you're in anesthesia, and the surgeon's like, okay, we'd like you to anesthetize this patient. And so this was a young girl, 7 years old, that had come in. She was from the rural areas of Ghana. One in which the history that I had is maybe that this developed over 6 months. In talking to the Dr. Kusi and the different staff at KATH, they said, oh, maybe they thought it was longer, and that maybe she had sought traditional medicine before coming to KATH. Next slide. So 7 years old, about 20.7 kilos, normal chest X-ray, no prior surgery history. No problems with regard to the chest tracheal deviation. Now there we don't have fiber optic or video laryngoscope, but in all honesty, this would have been difficult even for fiber optics. And I think the way that you'll see that they approached it would be the same way we would have had to at KU. Moses, one of the staff, he started a 22 gauge IV. And it was one in which, just think, this is a little girl, we can't give any sedation because of the airway. But Moses started a 22 gauge IV. We gave ketamine, which is, a IV anesthetic that can help support the airway, and she was spontaneously breathing. Next slide. And so this is the things I kind of like to show you. What was essentially was ventilated with a small pediatric mask over the nares. And I have to give credit to Dr. Kusi that, came up with thinking about this. This is after we secured the airway with a tracheotomy on the right with a 5.0 small tube. But Dr. Kusi wanted to show that, this is how a normal laryngoscope, there was no way to do our normal way of securing the airway. Next slide. This was the tumor that was taken out, more or less a giant cell tumor, which can develop, in the maxilla. So a very, very large tumor, but it was able to be taken out total. Next slide. And the patient afterwards, you can see, that there is a wide, able now to open her mouth. And next slide. But this is the one I think is the beauty of it, that when you really think that the girl came in, and probably as it was developing, she couldn't go out with other kids or families. There was social isolation. But now here's this young girl, a beautiful young lady, and I have to give credit to Anastasia, one of the KATH anesthesia residents who followed up on this, and that finally we were able to get this picture. And I hope that we'll be able to perhaps write this up and as a case report for perhaps one of the West African Journal of Medicine or Surgery. Next slide. Another wonderful, amazing thing that I've seen, that I got to see in September of 2018, was a separation of conjoined twins at KATH. We have 7 pediatric anesthesiologists on staff at KU, and I asked them, I said, have they ever seen separation of conjoined twins? And they said no. But KATH has had, I think, had done several of these cases. It was wonderful to be there and see their approach. one of the things I'd like you to see in the green scrubs is Dr. Addison. I think he's a wonderful clinician, and he was the leader of the team. I mean, just think, there are 2 surgical teams, there are 2 anesthesia teams. I believe Dr. Kusi was the other anesthesiologist, but the days before they took the care to find out what they would need to do their plan. And I took this picture on the day of. There was Dr. Addison going with his list, and let's see, on his right is Dr. Singh, at that time the chair of anesthesiology, going with his list to making sure that they had everything they needed, you know, to do this operation. And it was a long, all-day operation, and they were basically conjoined at the liver. Next slide. One thing in all this, I have to talk about the Kovac International Observership Award. And this was the thing we started. Residents in Peru asked, could they come to KU? And at that time, in 2015, I said, I don't know, I'll ask. And I initially asked in my department. I went around the university, and everybody said, well, I don't know. Gee, there's no funds for this. And so then I thought, and I asked, well, if I pay for it, can we do it? I said, sure. So I found out if you self-fund, you can do a lot of things. And that's where I started. Delia was the first resident, and we're learning and we're developing the program. And I could see that, one resident was, he had an experience, and it was the experience, and this is the desire. It goes back to Dr. Kizo, where he wanted his residents to see what was available in other countries and at Kansas, bring that back, that perhaps one day they would use those ideas. When I told him that I was thinking about bringing a resident from Ghana, another thing, a wonderful thing Dr. Kizo said, he said, I would like the Peru resident to come over at the same time as the Ghana resident. And we said, thought about it, okay, we can do that. And this is how it all started. And in our first year, we had Obi from Ghana, we had Luis from Peru. And it's interesting, I think through WhatsApp and that, they develop a friendship that then continue. The interesting thing is, since Dr. Urquizo was an international liaison for the Peruvian Society of Anesthesiology, they also wanted to have 2 other residents in which that they fund to come over. And so, and then we had Irene and Diana came as the Kovac awardees, and then the other Lydia and Jonathan came over from Peru. In the previous year, we had Karina and Dauberth. One thing I try to do for both Peru and Ghana is when I go back, we have an alumni luncheon in which all the alumni or anybody that's been to Peru or all they've been to Ghana, we meet together. And this was one of the years we had Obi, Anastasia, and Alfred. Next slide. So we've had the Kovac Award itself from KATH 3 and 4 from Peru. And it's under the umbrella-ship of, with the KU endowment, the Kovac International Education Support Fund, because the award is specific for the residents, bringing them in from Ghana and Peru. And one thing I wanted to have available for the Office of International Programs was if there was any monies that could be available for education support. And that's why one thing, some of the monies are used, for the Dr. Mani lectureship in November, but it's hopefully to used for in the future for anything related to international education. Next slide. So in conclusion, you have my beginning journey to global health, challenges, mistakes, and lessons learned. Next slide. So I learned to ask 3 big questions. What do you need? How can I help you? What can I learn from you? Next slide. And going forward, I've learned, what will I do? And I got the name, okay, them, not only from Dr. Mani's lecture, but I think also what I've learned from the courses I've already taken from InMed. What I want to do, I want to teach them to be the teachers. I want to empower them, facilitate them, encourage them, support them. Next slide. And in all interactions use, I mean, Dr. Mani used this word respect, and that's definitely, I definitely want to do that, but to also use understanding, patience, honesty, and humility. Next slide. And then I follow my heart rule. That rule I thought up that first night in Kumasi in Alfred's apartment. HALT. H, be humble. A, appreciate. L, learn. T, teach. Next slide. What is the future? I'm very happy to say that this young lady, and this is Dr. Serafina Cancum. She went to medical school at Kansas, anesthesiology residency in Wichita. She's now doing a chronic pain fellowship, and she's going to join our staff in the Department of Anesthesiology, I believe in July or August. She's a Ghanaian American. She's a chronic pain specialist. She's interested in teaching chronic pain in Ghana, and hopefully to help Dr. Kusi develop a chronic pain clinic there. I hope to find someone that will be a leader to go to Peru. And I know you already know in KATH and Ghana, you have Alfred as your future leaders. Next slide. Of all, this is my most favorite picture. Alfred's little girls. So I just say, any questions or comments?
Thank you so much, Dr. Kovac. I just am, we're all honored to be here with you, and it's a testament to one of your ways of interacting with the world, that there are so many friends from around the world on the Zoom today. So I want to just recognize our international participants today. I know we have Dr. Alfred Adu, we have Dr. Kuzi, we have Dr. Vega, Dr. Anastasia. So if any of you want to take yourselves off mute and ask a question or even comment, we know that Dr. Kovac has developed so many friends. I think someone's trying to say something and we can't quite hear it. Is that you, Dr. Adu?
Hello.
Hello.
Hi. Hello.
Hello, Dr. Aniva.
Yeah, this is what we're talking about. Hello.
We can hear you. Hello.
Okay, thank you so much. I am the CEO for the Cooperative Teaching Hospital. I just want to pass a few complimentary comments. I want to appreciate Dr. Kovac for his comprehensive lecture. In fact, his slides and the commentary that he's run has been a very big surprise to me, because I never knew he was doing such a compilation. And I want to put on record that the management of the hospital duly appreciate him and for putting these slides together for us to see clearly the kind of work that has been done as part of the cooperation and interactions between him and the center and then the Cooperative Teaching Hospital. We put on record the great exchange in terms of ideas that for him as a faculty that has been extended to the teaching and training of our specialists, our nurses, and especially for the special sponsorships and extended to Dr. Edu for him to undertake the fellowship attachment in his hospital. I have met him for the first time when he came back, I think, on his last visit. And I got to know from the notes the great impact he's made in the hospital, in our services, and for the kind of cordiality that has actually become established between our staffs on either end, and also for the teaching modalities that have been established. I think I want to put on record that we do formally appreciate Dr. Kovac so much and his beautiful team. I can see a long list that are participating in this meeting, and that is clearly to actually transcend and let the whole world see the beautiful relationship that has been built between our two centers. Thank you very much.
Thank you. Dr. Kovac, would you like to say anything else to that?
I would just like to say thank you very much for your comments. It means a lot to me.
I would like to also add that we learn and appreciate so much the residents who come to KU Med. We've made great friendships, and it's such a gift to have the visiting residents who come from Ghana and Peru, like Dr. Edu. Dr. Edu, would you like to say anything at this time?
Yes, I just want to say thank you to Dr. Kovac for the great presentation. I'm surprised, but I'm very excited to be part of this great thing. I would also like to thank our CEO, our head of departments, for being very helpful in everything that has gone on. Without them, this would not have been possible. They make their resources available for all these successes. Liaising with the customs officials, if we have to bring in equipment, let's send to the ministries to make for safe passage and hassle-free coordination. I want to say a big thank you.
Yes, you make a good point.
And I want to say thanks to the Office of I miss you all so much.
Well, I was just going to say, Dr. Edu, you make a great point that it takes a lot of individuals involved to make a bidirectional collaboration happen, be effective, and to be institutionalized, because that's really the goal, is to have it institutionalized so that it goes on and it continues and has kind of a life of its own based on education. Anyone else? Who else would like to?
Yeah, so we are hoping we can get more residents coming from not just anesthesia. One of the things that I've been hoping to do is to get the various faculties well linked. So family medicine, internal medicine, we hoping more residents and others get interested.
Yes, we are hoping for the same, especially once COVID allows for more mobility. I see Dr. Irene is on, Dr. Obi, welcome.
Dr. Anastasia has her hand raised. I think she might like to say something.
Hello, everyone. I want to say that was a very impressive presentation, and it was, I think Dr. Kovac has had a very, very powerful life, and it's a privilege to be even a tiny bit part of his story. As he was going through his presentation, I could recognize names, faces, places, even some people I never met, but I mean, Dr. Kovac talks so much about them that you would think you would know them. I think for me, the biggest benefit from coming into contact with Dr. Kovac is the fact that he leaves his comfort zone and immerses himself in our level. And in doing that, he gets to share and teach. It sort of inspires everybody else. You don't always have to have it all together. You don't have to have the money together before you start sharing or teaching the little you know. Sometimes some things do not seem so impressive, like the airway case he showed. When we saw the patient, yes, it looked like a difficult case, but it didn't sort of blow us away. But for him, it was something new. It's something might seem normal to you, but for an outsider, it might be a big deal. So whatever cases we see, whatever experiences we have, I think it's always good to share the little you have with other people. You never know who might benefit from the knowledge you have gained from one place. So I guess that's what I want to share.
It's such a good point, Dr. Anastasia, because when our residents go to Ghana or Peru, they are going to see cases and situations that they're not familiar with in the United States. So that's the beauty of the exchange, right? Is that you have the opportunity to teach those residents and to share your information and knowledge.
Yeah, and I think that that's a very important point, that to go over there and we learn their techniques. I think we get a bit spoiled, perhaps in our own hospital, with these fiber optics, video laryngoscopes, these high-tech type devices that actually, you know, that are not available in other parts of the world, and yet they give good care. There are good doctors in Peru and Ghana. They give good care. They know how to use the medicines they have, and they use them well. And I think that's how we can learn from them. Just like we've gone in Peru at the Hospital Oasa, they're skilled in using a type of technique. It's called TIVA, total intravenous anesthesia, with an apparatus that our FDA does not allow us to use, and we're not familiar with that technique. And I think just like Anastasia said, and I guess a quote I like to just repeat again, what Dr. Mani said: when you challenge your students, residents, and colleagues, take them out of their comfort zones, make them feel utterly uncomfortable and out of their depth. And I think that's what we do, and how we can learn from you.
I think Dr. Cominelis has his hand raised as well.
Dr. Kovac, that was amazing. Thank you. Very grateful the way you emphasized some of these really revolutionary kind of principles. A number of organizations in Kansas City go on service trips throughout the world. To some of them, this idea of going and sharing skills and exchanging ideas, and where appropriate, empowering others, is outside the norm. What would you say to people who are interested in just doing service? I just want to go see patients.
But it's of those that just want to do service. I mean, I think that service has a place. I think it's a learning experience that. And even what I've learned from the one course in international medicine and global health is that we have a lot to learn. And then first, before we go over there, but that the service does have a place and is good. I guess the fact is that what I've been doing is more centered on the teaching, the research aspects, but I'm not discounting the service aspects at all. I would like to raise the question though, is there a way we can study the service, the effectiveness of the service, which I think perhaps you and your organization has done perhaps on some of that.
Well, I would certainly agree with you that that's a step forward in trying to measure outcomes, the result of our service. Usually that's done just in terms of quantities. We saw this many patients in this many days. I think that is really raw data. Hopefully we can do better than that. One of the standards would be, well, has the level of health of the community increased? That's hard to answer, but I think that's a more relevant question.
Well, and I think another a kind of another thing that even which I see as part of your different courses is I mean basically I don't know exactly, but marginalized Americans. We talk so much about global health. Is there things we can do to help our own people, say even in the states of Kansas and Missouri? Can the principles we learn from global health be applied to our local health?
Well, and if the goal is to help, if that's really what's motivating someone, perhaps you should stay closer to home rather than spending the money to go abroad. But if you're wanting to engage with other people to learn and to promote education and bidirectional education, then there's truly value in that, right, Dr. Kovac? There's a lot out there that says that simply going and treating patients without relationships and without ongoing care actually can cause more harm than good. So the types of relationships that we have with institutions that are collaborative and educational, that's beneficial for all, for everyone involved. The benefit is exchange of ideas and learning. I see that Karina has her hand up and has for a while. Karina? Hi. Can you take off your microphone or turn on your microphone, Karina? Thank you.
Hello, thank you. Congratulations, Dr. Kovac, for your presentation. When I visit Kansas, I had experience extraordinary. Having a different vision as a resident is very important for the formation. Is other level. Dr. Kovac, eternally grateful. One question. When does Dr. Kovac return to Lima, Peru?
Well, I'd have to say, I hope in 2022, when it is safe and when we get the permission, okay, from the State Department, from the university, because it's something that both to Peru and Ghana, I really want to see all my friends again in person.
And I believe our CEO, Dr. Is it Ohinaba? Ohinaba, you have your hand up. Oh, can you unmute yourself, please?
Sorry, yeah. Just a few points before I sign off. Unfortunately, I have another meeting, and therefore I will have to check into another meeting. I think the question of assessing the impact of some of these voluntary services is very, very critical. And that even as we do some of these collaborations, it is important that we are able to put together some research work, some kind of findings scientifically, and also about the impact of these collaborations themselves. But for almost all the engagements I have been involved in for these collaborations, I've always said that one of the key things that will concretize some of these collaborations is about putting a common research topic and joint research together for publications and what have you, so that those things will stand in our name for others to see the joint and the joint works that we are doing, but also evaluating and publishing the impact of our works is even more critical. I believe that service is good, but certainly where opportunities are available, it is important that service is almost always combined with technology and skill transfer, because I think that leaves a very lasting impact, and that also helps in empowering and also building capacity at either end. Because like you said, for medicine, the knowledge is unlimited. Because of our differences in our biological backgrounds, there are some cases that you may not even see in the areas of practice. But this kind of exchanges will expose us to some very rare conditions in places that we travel to see what others are doing. So I think that would be very, very welcome. Thank you so much.
Thank you.
I may have to sign off from here. Thank you so much.
Thank you very much.
I have to say, I absolutely agree with those comments and the need for research. And also, Dr. Kovac, kind of leveraging your relationships and partnerships to do some research and publish together. And I know you've done at least one publication and several presentations. I think the problem with service is that it's a lot of times it uses a deficit approach and lens to partnerships. And we need to always be thinking of our partners and using an asset-based engagement model. So what are the assets? That's very empowering to local communities. And there has to be ownership of the educational narrative, that is in place. I think that's one way to preserve, the community's own expertise, knowledge, and skills. So we should do research on that, definitely. Do we have any final comments?
I think Dr. Adu had his hand up earlier as well.
Yes, what I'd like to finally say is that we have a lot to learn from Dr. Kovac. I've helped a number of institutions trying to collaborate, but the difference I've had from Dr. Kovac and what come to a place, you can come do surgeries and then leave, but you can come like he does, try to spend time to find what really is needed in a more lasting way, whether you are present or absent, and that makes that gives friendships that even after you've left, we can actually stay in touch and then learn. That is one thing that I think that we should maybe learn from going forward. And I think that he's a great resource that anyone coming would be great to talk to. Thank you very much.
Thank you, Dr. Adu. Have we missed anyone else, Christine or Alexa?
No, I don't think so.
All right. Dr. Kovac, any last words before we stop recording?
Well, I guess maybe just to say, for my own, it's a journey, it's a continual process of learning. And I think it's a thing that we need to just like in simulation, you will debrief, you will reflect. We will say, what are we doing wrong? What we can do better. I think an important point is, and I think like what Alfred mentioned, finding out really what do people need, what do they want, and how we can help them best. And I think through education, the fact if we can help teach, it will, just like the saying, you give a person, you teach them how to fish, feed them from the lifetime. The teachers will teach other teachers, and then essentially, I guess it's a thing, even like Dr. Mani will say, is that they've learned, and they may not say, well, we've learned from you. And I guess it's the thing is that I continually want to stretch my comfort zone. I'd have to say too that I know that even InMed has a hospital in the Kumasi area. I don't know, 25, 27 kilometers away, that I hope that I can visit, that I can learn and see what they're doing there. And I think that we learn together to go as teams, to learn as teams, to help as teams. And I think.
Fantastic. Thank you so much, Dr. Kovac. You are a friend to so many of us. I hope you know how much we all love you and appreciate the work that you do and your generous, humble heart. Thank you, everyone. If you want to stay on and chat, absolutely do so, or we will stop the recording. Thank you for being here.
Well, thank